Clinical genetics is a branch of medicine that specialises in genetic disorders, and it's designed to help people who have or who are at risk of a genetic disorder. 1 in 17 people will be affected by a genetic disorder, and although individually they are very rare, collectively genetic disorders are common, and there are 7,000 different types. So it requires someone with specialist knowledge of clinical genetics to be able to help people in that situation. So my job is to take into consideration lots of different elements about a person's risk for a genetic disorder, namely their family history and their early health and development profile, and to see if piecing all those aspects together can help me come to a diagnostic shortlist and provide them with the most appropriate tests to allow a diagnosis to be reached accurately and as quickly as possible. As a geneticist, I help patients of all different ages. Primarily, I am a paediatrician and I specialise in genetic disorders that affect children, but genetics applies to people from cradle to grave and before that and beyond, so I help all sorts of different people. Principally in paediatric genetics, I see children who may have a number of different problems. Perhaps they're not growing properly, perhaps they look different to other family members, their development is not as it should be for a child their age, and my job is to bring together all the different elements of that condition and see if I can come up with a genetic diagnosis by implementing the most appropriate test for that child. So that could be a chromosome test, or it could be a single gene test, or increasingly available to us now in our genetics toolbox is next generation sequencing, where we can undertake genetic testing of hundreds or thousands of genes and tailor the analysis to a patient's individual requirements based on their clinical history to come up with the diagnosis that's appropriate for them. Clinical genetics is a fast-moving speciality that is benefiting from an evolution in genetic testing. In recent times, we have improved our ability to test chromosomes, this test having gone from being a microscope-based analysis to a much higher throughput test using DNA-based molecular technology. Similarly, in genetic testing, we have moved from a platform where we needed to analyse genes on an individual basis, gene by gene, and therefore requiring us to be able to identify which of the 20,000 genes to start with, to the test being a much higher throughput test so that we can analyse thousands of genes in one go. But this still requires us to use our expert knowledge to be able to interpret the results on an individual basis bespoke to a patient's particular situation. I recently saw a 3.5-year-old boy who was brought to see me by his mother. This boy was not yet walking or talking, and he also had a number of medical problems as well. As such, he'd seen lots of different doctors and lots of different specialists to try and explain on an individual basis all these different problems. But nobody had the opportunity to think about all of these problems in one. And having taken a history from the mother and explored the family history and drawn a pedigree, having examined the child, I was able then to suggest some further tests, which then came up with a diagnosis for the child. So having had his genetic condition explained, I was then able to offer advice on follow-up management for that child, but also to provide genetic counselling for the more extended family to ensure that their chance of having a child with similar issues was reduced.